Pelvic organ prolapse is what you hear when somebody says that their bladder is dropped, or their rectum is bulging, or they're having something that's coming out of the vagina. The causes of pelvic organ prolapse are childbirth or anything that causes damage to the pelvic floor, a stressful job or any strenuous activity that's repetitive in nature, and also there are hereditary factors where the collagen in the pelvis or the pelvic floor structures are just not genetically strong enough to support a normal, active, healthy lifestyle. Symptoms of pelvic organ prolapse include bulging of tissue through the vaginal opening, pain with intercourse, urinary incontinence, urinary retention, difficulty with bowel movements, constipation, and pelvic pressure. The first way we diagnose pelvic organ prolapse is through a complete and thorough physical examination. We also use urodynamic testing. Urodynamics is when we actually determine how your bladder actually functions. It's technical, but relatively simple to do and gives us a lot of information. We also use ultrasound to determine if there are any masses in the pelvis that could cause the pelvic organ structures to drop. There are several approaches to treatment of pelvic organ prolapse. The first is the most conservative and is used in the most mild of cases. We can actually employ pelvic physical therapy, where a specialized physical therapist in pelvic disorders helps you to strengthen and treat the muscles of the pelvic floor. Another way to treat pelvic organ prolapse is through the use of a pessary. A pessary is a device that's placed in the vagina to help to support the pelvic floor and help support the organs above it. It's often not a very comfortable way of doing so and is mostly used in people who are not very physically active. Finally, there's open surgery and robotic surgery to help the most complex conditions. There are 5 types of pelvic organ prolapse: cystocele, rectocele, uterovaginal prolapse, vaginal vault prolapse, and enterocele. A cystocele is when the bladder drops into the vaginal vault and sometimes even protrudes through the vagina. A cystocele is treated based on its severity. If it is mild, we can treat it with pelvic physical therapy and pelvic exercises. If it is more severe, outpatient surgery is the mainstay of that therapy. A rectocele is when the rectal wall bulges into the vagina and may also protrude through the vaginal vault. Treatment for a rectocele is very similar to treatment of cystocele. Uterovaginal prolapse is when the entire uterus and vaginal vault protrudes through the vaginal opening. If it is mild in severity, we use pelvic physical therapy. If it is more severe, at that point we would consider robotic or open surgical techniques. Sacral colpopexy is the gold standard for this type of treatment. Attaching a graft, a surgical mesh, between the sacrum and the vaginal vault helps to support the pelvic floor structures. Vaginal vault prolapse is when the upper vagina can actually become involuted. It actually folds over itself and can protrude all the way through the vaginal opening. Vaginal vault prolapse only occurs in those people who have had a previous hysterectomy. Vaginal vault prolapse is also treated with sacral colpopexy. Although many people have questioned the use of surgical mesh in procedures to treat pelvic organ prolapse, mesh can be necessary. It is the type of mesh, the way the mesh is applied, and where the mesh is applied that actually determines the outcome. An enterocele is when the small bowel starts to protrude into the vaginal vault. We use a procedure called Hallband's caldoplasty, placing some sutures to obliterate the sac in which small bowel protrudes into the vaginal vault. The good news is, despite the fact that pelvic organ prolapse is a very complex condition, we can help you in so many different ways. What you need to know here is that pelvic organ prolapse can be treated. You can return to a normal, happy life with the right interventions.